All right, everyone. Let's dive deep into the world of Actinomyces.
That's good.
We're going to be looking closely at principles and practice of clinical bacteriology.
Okay.
And we're going to be extracting some seriously useful information for medical microbiologists.
All right.
Get ready for some intriguing insights into these bacteria.
Yeah.
Because they can cause some real diagnostic puzzles.
Wow, they can.
For example, you might be surprised to learn that those sulfur granules we often associate with Actinomyces,
Right.
they don't actually contain sulfur.
Oh, really?
And their ability to mimic other infections.
Yeah.
They're masters of disguise.
That's right. Actinomyces can be a bit unpredictable.
Yeah.
It's crucial for us in the lab to understand their characteristics.
Especially when those tricky cases come our way.
Yeah, definitely.
So let's start with the basics.
Okay.
What are we dealing with when we talk about Actinomyces?
Well,
And why should medical microbiologists be particularly interested in them?
there are these slender branching bacteria,
Oh, okay.
gram-positive, of course.
Right.
And they're anaerobic, but some can tolerate a bit of oxygen.
Interesting.
They like to call our mucous membranes home.
Okay.
And while they're usually harmless, they can become opportunistic pathogens.
Opportunistic pathogens,
Yeah.
meaning they need a little push to cause trouble.
Exactly. They kind of need an open invitation, like a break in the mucosal barrier,
Got it.
or a foreign object gets in there,
Okay.
and then boom, they can cause a range of infections.
Wow.
From the classic actinomycosis
Yeah.
to more subtle infections that can really mimic other conditions.
So this mimicking business,
Yeah.
that sounds like a real headache for us when we're trying to diagnose.
Oh, it definitely can be.
Yeah.
You see Actinomyces present in so many different ways.
Right.
And to add to that,
Yeah.
they can look quite diverse under the microscope.
Interesting.
Some species, like A. israeli,
Good.
they form these really tough, gritty colonies that are just so difficult to emulsify.
Oh.
Imagine trying to get a smooth suspension for susceptibility testing.
Yeah.
It's like wrestling with a tiny, stubborn pebble.
So we've got these bacteria lurking in our mucous membranes, just waiting for the right moment to strike.
Right.
I'm already sensing a theme of expect the unexpected here.
You're catching on quickly.
Yeah.
Now, you mentioned sulfur granules earlier.
Right.
And that's a perfect example of a clue that can really point us in the right direction.
Yeah, those sulfur granules,
Yeah.
which aren't actually full of sulfur.
Exactly.
Right.
They're actually made of tangled bacterial filaments,
Okay.
and they play a key role in the pathogenesis of actinomycosis.
So they're not just a microscopic curiosity.
Yeah,
They're actually contributing to the disease.
absolutely.
Wow.
These granules act like little fortresses,
Okay.
shielding the bacteria from our immune system.
So they're protecting them.
Yeah, and even making them more resistant to antibiotics.
Oh, wow.
This is why treating actinomycosis can be so challenging.
Sounds like it.
It's like trying to break down a castle wall.
So these granules are a double-edged sword.
Yes.
They're a helpful clue for diagnosis,
Uh-huh.
but they also make treatment much more complicated.
Precisely. And speaking of diagnosis,
Yeah.
getting the right specimen is so crucial.
Okay.
Post or sinus tract exudate is the gold standard
All right.
because they're more likely to contain those telltale granules.
Makes sense. We want to catch those little fortresses in action.
Exactly.
But what if we're dealing with a case where the clinical presentation is less clear-cut? How do we even begin to suspect Actinomyces in the first place?
That's where a good clinical history comes in.
Okay.
Things like recent dental procedures, the
Mhm.
presence of a foreign body,
Okay.
or even a history of IUD use.
Good.
These can all be valuable clues. And remember, actinomycosis can mimic other conditions,
Right.
like tumors or tuberculosis.
Oh, wow.
So it's really important to keep it on your differential diagnosis, especially in those cases that aren't responding to conventional therapies.
So it's like being a detective.
Yeah.
Piecing together those subtle clues to crack the case.
Exactly.
I like it.
And once we suspect actinomyces,
Yeah.
we need to be strategic in the lab.
Okay.
Culture is still the gold standard for diagnosis,
Right.
but these bacteria can be slow-growing,
Right.
and they require specific media and conditions.
So we need to be patient
Yeah,
and give them the right environment to grow.
exactly. We're talking about extended incubation periods,
Okay.
sometimes up to 2 weeks.
Wow. That's a long time.
And because actinomyces can be quite sensitive to common antibiotics that
Yeah.
we use in anaerobic cultures,
Yeah.
we need to be careful with our media choices.
So it's not as simple as just throwing a sample on a standard agar plate
Yep.
and waiting a couple of days.
Not quite. And even when we do get growth,
Right.
identifying the specific species can be really challenging.
Interesting.
Their morphology can be variable. And those traditional biochemical tests, they can be unreliable.
So we're back to those masters of disguise.
Yeah.
How do we even begin to sort them out?
Well, that's where those more advanced techniques come in.
Like what?
Well, gas liquid chromatography can help us analyze their metabolic byproducts, which gives us clues to their identity.
Got it.
But for a definitive species level identification, we often need to turn to molecular methods. Like PCR RFLP.
PCR RFLP. That sounds pretty high tech.
It is, but in simple terms, it's like we're taking a bacterial DNA fingerprint. We amplify specific regions of their DNA. And then we use enzymes to cut them up.
Interesting.
Creating these unique patterns.
And we can use that to tell them apart.
Yes, we can use those patterns to differentiate between species.
Very clever.
It's been a real game changer for Actinomyces identification.
That's great.
Especially with those newer species that are constantly being discovered.
Yeah. So it's like we're using their own genetic code to unmask them.
It is a powerful tool.
It sounds like it.
And it's helping us uncover this incredible diversity within the Actinomyces genus.
I see.
Which brings us to another important point.
Okay, what's that?
The genus Actinomyces is constantly evolving.
Wow.
New species are being discovered all the time.
Right.
And our understanding of their role in various infections, it's constantly expanding.
So staying up to date with the latest research and classification schemes. That's essential for us as medical microbiologists.
Absolutely.
Like we're constantly adding new pieces to the puzzle.
Exactly. And the more pieces we have, the clearer the picture becomes.
That's a good point.
But remember, the foundation of our knowledge, it comes from those core principles and practices that are outlined in resources like Principles and Practice of Clinical Bacteriology. That's where we build our understanding.
It's our guidebook to navigating the world of Actinomyces.
Speaking of navigating, shall we move on to the challenges of antimicrobial susceptibility testing for these bacteria?
Let's do it. We've covered a lot of ground already.
We have.
But I'm eager to hear what makes Actinomyces such a unique challenge when it comes to susceptibility testing.
All right. Well, their slow growth can be a real challenge for us. Standard disk diffusion, for example. It isn't always reliable.
I see.
Because by the time our slow-growing friends start to show up, those antibiotics have already diffused widely across the plate.
Interesting.
It's like trying to run a test on a slow-burning fuse. You really need to be patient and precise.
So we need a more tailored approach.
Exactly.
One that takes their slow growth habits into account. Determining minimum inhibitory concentrations. Or MICs, as we call them. MICs.
Using techniques like agar dilution or 8-test is often a better choice. It gives us a more accurate picture of how much antibiotic is needed to stop these bacteria in their tracks.
So we're carefully calibrating the dosage.
Exactly.
Making sure it hits the target.
That's a great way to put it.
Okay.
Now, the good news is most Actinomyces species are generally susceptible to common antibiotics. Like penicillin, tetracycline, and erythromycin.
Okay, great.
There's always a
but. We can't get complacent.
Of course not.
There are always exceptions. And those pesky resistance patterns.
Those resistance patterns.
Lurking in the shadow.
Always lurking. Some
species, like A. odontolyticus, can have higher MICs.
Really?
Yes. So we need to adjust our treatment strategies.
And what about the newer species?
Yes. As we uncover those newer species, we need to be even more vigilant. Because their susceptibility patterns.
They might not fit the traditional mold.
So it's a constant learning process.
It really is.
It's a reminder that we can never truly rest on our laurels.
That's right.
There's always something new to discover.
Always.
And some new challenge to tackle.
Couldn't agree more.
Speaking of challenges, let's shift gears a bit.
Okay.
And put your knowledge to the test.
Sounds good.
Are you ready for some quick-fire exam questions?
I think so.
Let's see how much you've absorbed from our deep dive into Actinomyces.
All right, bring it on.
All right, question number 1.
Okay.
What morphological characteristic makes Actinomyces Israeli colonies particularly challenging to work with in the lab?
This takes me back to those stubborn colonies we discussed earlier, if I remember correctly.
Yes.
Israeli forms those hard, gritty colonies,
Right.
often described as breadcrumb or molar tooth colonies.
Mm-hmm.
They're notoriously difficult to emulsify,
You got it.
making tasks like susceptibility testing a real pain. Phew.
It's those tough, gritty colonies that can make lab work feel like you're trying to grind up pebbles.
Exactly.
All right, question number 2.
Okay.
True or false? Actinomycosis is highly contagious.
Thinking back to the pathogenesis of Actinobacteria,
Right.
they need an entry point. That breach in the mucosal barrier
Yes.
or a foreign object to cause infection.
Right.
So based on that, I'm going to say false.
Okay.
They're opportunistic,
Right.
not typically spread from person to person.
You're on a roll.
All right.
That's absolutely correct. 2 down. Keep them coming.
Okay, question number 3.
Okay.
What is the primary reason why disk diffusion methods are not ideal for Actinomyces susceptibility testing? This one's all about those slow-growing microbes.
Right.
Disk diffusion relies on the antibiotic diffusing outward while the bacteria are actively growing.
Right.
But with Actinomyces being such slowpokes, by the time they get going, the antibiotic's already spread across the plate, potentially leading to inaccurate readings.
That's a brilliant deduction.
Thanks.
You've hit the nail on the head. Their leisurely growth just doesn't mesh well with the fast-paced world of disk diffusion.
It really doesn't.
Okay, feeling pretty good about my Actinomyces knowledge now. Hit me with question number 4.
Here we go.
All right.
Which 2 antimicrobial agents?
Okay, 2 antimicrobial agents that don't work well against Actinomyces.
Right.
Let me think.
Okay.
We know penicillin is a good choice. So what are the ones we typically avoid? Thinking back to our discussion about sometimes needing to target those companion bacteria that might hang out with Actinomyces. I think I have it.
Okay.
Metronidazole and aminoglycosides.
Bullseye.
Yeah.
You're on fire. Those 2 are typically not effective against Actinomyces.
Okay, great.
They just don't pack the punch we need.
Right.
All right? Feeling like a true Actinomyces whiz kid now.
I'm getting there.
Okay, last but not least.
Okay, what's the final challenge?
Apart from penicillin,
Right.
name 2 alternative antibiotic options for treating actinomycosis in a penicillin-allergic patient.
Penicillin allergy alternative options.
Right.
We need something that's effective against Actinomyces, but won't trigger those allergic reactions.
Right.
I'm going to go with tetracycline.
Okay, good choice.
And clindamycin.
Excellent choices.
Yes.
Both are solid alternatives when penicillin is off the table.
Right.
Erythromycin and cephalosporins can also be considered, depending on the specific situation.
So even when penicillin's out of the picture, we've got options to fight back against these pesky Actinomyces.
Exactly. We're not defenseless.
Good to know.
And remember, even though many Actinomyces species are susceptible to these antibiotics, we always need to keep an eye on those emerging resistance patterns.
Of course.
And tailor our treatment approaches accordingly.
Vigilance is key.
It is.
It seems like our listeners have been paying close attention.
It seems like it.
Because they aced the exam.
I'm impressed.
It's fantastic to see such engaged and knowledgeable microbiologists out there, clearly passionate about the world of bacteria.
It's inspiring to witness such dedication to this field.
Absolutely. So before we wrap up our deep dive into the world of Actinomyces, any final thoughts or insights you want to leave our listeners with? It really is amazing to see how much people care about learning this stuff.
It is. And you know what fascinates me?
What's that?
How much there still is to learn about Actinomyces.
Oh, yeah, for sure.
I mean, we're finding new species all the time.
It's true.
And figuring out their role in all these different infections.
It's a constant reminder that there's still so much to discover.
Yeah, the microbial world is full of surprises.
Like a vast uncharted territory.
Exactly. And with all the new technologies like genomics and those molecular techniques, we're gaining all these new insights.
It's incredible.
It makes you wonder what we'll find out next.
I know, right?
Maybe even new ways to diagnose them.
That would be huge.
Or new targets for treatments.
Yeah.
Or even a better understanding of how they interact with our own microbiome.
It really is an exciting time to be a microbiologist.
It is.
So to all our listeners out there, keep that sense of wonder alive.
Keep asking questions.
And keep sharing your knowledge and experiences.
Exactly. The more we learn and collaborate, the better we'll be at tackling these challenges.
Well, that brings us to the end of our deep dive.
It does.
Into the world of Actinomyces.
Fascinating little creatures, aren't they?
They really are. We hope you've enjoyed this journey.
I hope so, too.
Into this often overlooked realm of these remarkable bacteria.
Until next time.
Keep those microscopes focused.
And those minds curious.
The microbial world is teeming with discoveries.
It is just waiting for us to find them.